parenting. This is Dr. Sindhu from Twins World. As I already said, I'm a mother of twins. I'm a working professional as well as a skilled trainer. And in this session, we are going to talk about a safe environment for a baby or an infant. And the first point I would like to discuss is to have a hygienic practice, better hygienic practice. In that the first one is wash your hands before and after you are preparing a feed or any kind of formula feed or doing anything for the child. Second thing is before and after giving a bath to the baby. Third one, after changing the diaper or cleaning the private area of the child or any other matters. If you're handling the child, we need to wash the hands. Next point I would like to discuss is baby proofing the house. So baby proofing can be done as a separate session in toddler, that is 1 to 3 years, where the importance of baby proofing is more in that particular age group. The next point I would like to cover in having a safe baby environment is the health of the mother. The mother is always busy going behind the baby, but we need to understand that the immunity of the mother is also equally important like the baby, because if the mother get an illness, what happens is the baby also tend to get it immediately. So what we can do is, if the illness is very serious, maybe a cough, a running nose or anything, tell the partner or the spouse to take care of the baby for 1 or 2 days and treat the mother immediately so that the baby will not get the illness. It's 99% chance for the baby to get an illness if the mother is being sick.
The third point under a safe infant environment is the storage of diapers. We need to understand that any stuff, if you're not touching for a longer period, it can attract the molds and the fungus. Buy sealed packets of diapers whenever you are buying it from the shop, and whenever you are keeping any loose diapers or open diapers, keep silica gel packets so that extra waters or any moisture can come, it can be absorbed. And in a rack or in a drawer or somewhere, you can keep all the stuff for the changing the diaper can be kept. Maybe the diapers, the diaper changing sheet, a flannel to wrap around the baby, the baby wipes and the talcum powder. So this way you can manage the time and do the diaper change a little faster. And next, while you go for a travel, always have a ready traveling pack. And mainly the travel pack or the traveling baby bag contains 2 sets of clothes, because we don't know what time the baby can vomit that way or pee or poo. So this can make the baby to change the dress, and a set of diapers. And what you can do is you can have a talcum powder with a puff. Always better use a puff to use powder for babies. Other than that, you can have disposable plastic cars or any other cars where you can dispose the soiled diapers. Other than that, you can have a bowl and a spoon and the food in a airtight container if the baby already started with food, other food from the 6 months of age, and the necessary items like baby lotion, baby wipes and a hand wash, so that the immediate care can be done, and you're carrying this bag till the baby is merged with an adult life. Next point what we can discuss under this particular topic is disinfecting the house. So we need to understand that mosquitoes are one of the main issues always we are concerned about if the house having mosquito issues. Until 2 months we can use a small mosquito net, so the baby will not move much, the baby will be under the net. But once the baby started becoming big, then the issues of mosquitoes and flies will come. So we need to understand that before the baby comes, it will be better you fumigate the house so that all these pests won't disturb the family routine or the health of the baby. Another thing what you can do is you can use the odorless mosquito repellents or any pest repellents like paste. You can get it and you can use it every 6 months so that these insects will not affect you. Otherwise, once these insects like cockroach, flies, all those things comes, there is a high chance of bacterial infection. And as we regularly know that we need to have little more focus on the cleanliness of the kitchen, bathrooms and wash basin, where more growth of bacteria will be there, and adequate use of pesticides can remove all these things. And the things like we cannot move, we can use a spray of any antibacterial so that the growth of the bacteria can be avoided. Daily mopping of the floors with antiseptic solution also helpful for us to avoid any kind of bacterial growth, any growth of mosses in the house. The next point I would like to discuss is the clothing of the baby. Clothing of the baby can be done as a separate session because we need to think about the measurement of the clothes. Clothes like hand-me-down clothes are preferable. Hand-me-down clothes means the clothes has been used by one baby can be given to a next baby, like my sister has a baby now, so I give all my clothes of can keep to them. So that what happened, the clothes have been regularly washed so that the material is a little more softer and it's better. The more washed clothes will be the better clothes for other babies because the texture of the clothes will be very soft and the baby will be more comfortable. So this is encouraged among all the families. We may not be preferred to give to someone else, but inside the family we can give to others. Remaining points we can discuss in the next session. The next is the management of the toys. We know that there are a lot of toys we are using for the babies. So whenever you are using the toys, if it is plastic and it can be washed, it's better we wash it and we'll wipe it and keep it for air drying twice in a week so that these things will not be a source of infection for the babies. Other kind of toys you can either wipe with baby wipes or any with good cloth, which is wet cloth, wipe it and air dry it. Otherwise this can be a source of infection for the babies because babies will keep all these things in the mouth. Another point or the last point to discuss under the safe environment of baby is the bedding of the baby. We need to understand that when you're keeping the baby on a bed, we have a thick cotton mattress. So what happens to protect the baby, we can keep a plastic sheet so that on the plastic sheet you can put a flannel cloth or little thicker cloth, and above that we can put a thin cotton cloth and keep the baby on. So in the night, in order to avoid the bed wetting, you can keep the baby on diapers, and if you're not preferring for a diaper, that when the baby passes urine, and the beds can be saved by having this many clothes. And whatever you are using, it will be always good that you are air dry the mattress and the bedding once in a week so that the beds also can be preserved and can be out from any kind of source of infection. Hope this session is helpful for you to have a safe environment for a baby or an infant. See you next time. Thank you so much.